My name is Giselle, and I'm going to talk to you about 4 different types of nursing delivery care models. The first one is known as a functional nursing care model. The second one is team nursing care model. The third one is known as total patient care model, and the fourth one is known as a primary nursing care model. The first one we're going to talk about is functional nursing care model. This consists of RPN, an RN, an LPN or an LVN depending on what state, and a UAP, as well as a charge nurse. How is this work divided? The charge nurse assigns tasks and evaluates. The RN assesses. The LPN or LVN administers medications and wound care, amongst other things. And the UAP is responsible for ADLs and vital signs, also amongst other things. The advantages of this nursing care model is that there are less RNs needed for nursing care, and the staff become efficient and effective at their tasks. Disadvantages are that there is uneven continuity of care, as well as a lack of holistic understanding with the patients, and there are also problems regarding follow-up care. This is a diagram of this kind of model. You have a charge nurse, and this charge nurse delegates responsibilities to a med nurse, a treatment nurse, UAP with bathe duty, a UAP for vital signs, and a UAP for transporting. All of these nurses and UAPs are responsible for all of the patients on the units. Depending on the number of patients and acuity, you might have less nurses and less UAPs, and if you have higher census and higher acuity, you may have more nurses and more UAPs. Second model we're going to be talking about is the team nursing care model. This consists of an RN, LPN, or LVN, and a UAP, as well as a charge nurse. This work is divided by the charge nurse, which assigns teams and chooses team leaders, or RNs, for these teams. The one RN, which is considered the team leader, divides patient care and assigns duties to the other RNs, LPNs, and UAPs. The RN and the LPN are also responsible for MedPass, things such as wound care and assessments, and the UAP is responsible for ADLs, vital signs, amongst other things. Advantages of this kind of delivery care model is that the team acts as a whole and has a holistic perspective with the patients. There are geographical boundaries which save time and steps because the patients are grouped up depending on the nurse's station or diagnosis or healthcare provider. Disadvantages is that there is too much time spent in communication between the team leader and the team. There's not one person that considers total care to that one patient, and there's resentments towards the team leader. The reason being that the team leader does more of the paperwork and not so much physical labor, but the team leader also has to make sure that they're communicating the plan of care effectively with the rest of the team, patients, and healthcare providers to provide some form of holistic patient care. And this is a diagram of a team nursing care model approach. You have a charge nurse, which assigns 3 team leaders, or RNs, and those team leaders divide their tasks and responsibility amongst the RNs, LPNs, and UAPs on their team, and then they provide patient care to their patients. As well, this model, just like the other model, also depends on acuity and census. The higher census, higher acuity, the more nurses and UAPs, and the less census, less acuity, the less nurses and less UAPs. The third model we're going to be talking about is a total patient care model, which is also known as case method model, and this consists of a charge nurse and registered nurses. This work is divided. The charge nurse divides patient assignments and evaluates overall care, and the registered nurse delivers all aspects of nursing care. You see this mostly in critical patient care units as well as post-anesthesia care units, where the nurse has much higher acuity patients, therefore they deliver all the care to the patient to make sure that there's holistic care for this patient and communication between healthcare providers and patient families. Advantages of this kind of nursing care model is that it's continuous, holistic, and expert nursing care. There's total accountability for nursing care and continuity of communication. The disadvantages are that the nurses spend some time doing tasks that could be done